morning. Good morning. Thank you. So, how's everybody feeling this morning? You ever heard that question before? When you walk in, the physician comes in, you're sitting there on that butcher paper on the bed. So how are we feeling? Well, not so good. I wouldn't be here. I want to tell you, I'm feeling great this morning. I know because I've got so many physicians that are in the audience and so many people that are supporting health care across the state of Mississippi, including the First Lady. I spent 38 years working at one of the finest hospitals in the state of Mississippi, St. Dominic's Hospital, 38 years. So I've got my own medical advisor. Glad to see Glenn McCullough here and the MDA team. You've got to realize just how important this is, because as we started this with Dr. Hayes, I was there on Clay's treadmill one day just running away, and Clay likes to talk to you when you're on the treadmill with that thing jacked up at full speed. And when you're just sucking wind as hard as you can, he goes in, "Hey, Governor, how you doing? I think we're going to have a new summit." Great. So, but I can tell you, Clay Hayes has been with us since the very beginning, since we formed our very concept of having health care as an economic driver and putting in the Governor's Healthcare Solutions Institute. Here's a guy that's got a pretty busy practice, a lot of patients, led the Chamber of Commerce, and now I call on him and he steps up each and every time. So Dr. Hayes, thank you so much for what you've done. Give him a hand, folks. Scott Waller, MEC in 2011, I called on them when Blake Wilson was here and said, Blake, I've got an idea. And Blake kind of got accustomed to me walking in and said, I've got a new idea, which meant I needed MEC to spend a lot of money, raise a lot of money, and go out and do a study to determine what we needed to do with health care in the state of Mississippi. Everyone always talks about, oh, you got terrible health care. You got terrible health care ratings with your population. But a very wise man once told me it's not just health care, it's access to health care. And as I looked across the state of Mississippi, I realized what a challenge it was for access. So we decided, working with MDA, to look at health care as an economic driver, just like the automobile industry. If every time we've got a physician, we would say, that what one physician can create jobs, the multiplier effect of that one doctor in a community can be $1.5 to $2 million. And so MDA has been helping along the way, making sure that we look at it as the aerospace industry, as the manufacturing industry in the state of Mississippi, as tourism, and then there's health care. 99 different acute care hospitals in the state of Mississippi employing 60,000 Mississippians. I'm going to show you in a minute just what an economic impact that is. Our universities, not just the University of Mississippi, UMMC, which has a pretty nice new medical school up there, but our community colleges, which are now and have been working on, I think, some of the most talented nurses in America, trying to keep them here in the state of Mississippi. Scott, thank you for Blueprint Mississippi. In 2011, in December, we went to Houston, Texas, met Dr. Nawardi, and we saw something remarkable, a medical city, and I just fell in love with it. So I'm going to start with my PowerPoint before I talk over every one of them and give you a little idea of how proud we are of what we have accomplished, much of which since 2011, when Blueprint Mississippi came out and told us what we could do. And if I can get this working as I should, absolutely. So I'm very proud, as you know, of the new medical center. I always thought we had a medical school, and we did. In fact, and the doctors can tell you more, but the medical book that's still now used around the world was written by one of our, Dr. Guyton, one of the top professors at the University of Mississippi. It's used today. I think it's been probably the most published and most used medical book in the world, medical teaching and instruction book in the world. So as we talked about creating a new medical school, we looked at UMMC, and what we were having to do is our medical students were going sort of from building to building. We didn't have one new, modern, shining building. And I remember going to then the director and said, we're going to build a new medical school. And he said, Governor, we don't have a new medical school. I said, well, I think I've got about $15 million of CDBG money. That's federal money. And I'm going to invest that. We're going to have a groundbreaking. We're going to get the lieutenant governor and the speaker and everyone out there, and we're going to take pictures of them. And then they got to give us the rest of the money. Jimmy was scared to death over that. He just said, oh my God, I said, Governor, I don't know if we can do that, and we did it. cut the ribbon on that school this year. It is absolutely remarkable, probably one of the most technologically advanced medical schools in the nation. Now, you probably don't read, there was some coverage on it, but you won't hear that a lot. But it is something that I'm very proud of in the state, because if you see, what we can do is we went literally from about 100 physicians to 145, and that was really a cramped, difficult place to be, and to 165, because I said as Lieutenant Governor, my goal was to have 1,000 new physicians by 2025. Not just the ones that we have now and after the ones that are retiring, but 1,000 new physicians, because necessarily they're going to be into areas that are underserved medically. I'm from Moorhead, Mississippi. I'm like Jimmy Hayes, Clay's dad. You know, I'm from Moorhead, Mississippi. Now, we moved to the metro area, a lot of folks from the Delta when I was very young, but when you're from Moorhead and the Delta, you really can't ever be from anywhere else. That's just the way it is. And healthcare delivery in the Mississippi Delta was Dr. Phillips. I don't know how he did it. He went all over the Mississippi Delta, and he was the physician for the Department of Corrections. Yeah, so Dr. Phillips delivered me in 1954 in Moorhead, Mississippi, and I tell people, if you were delivered by the prison doctor, you might be a redneck. He was a remarkable man to this day. In fact, we're building a new medical clinic in Moorhead right there on Walnut Street on the corner, and it's going to be the Dr. Phillips Medical Center. Because of the amazing job that he did. But if you see again, the project will create $1.7 billion in economic impact by 2025. Billion, that's with a B. That's 1,000 million, 0.7, 19,000 new jobs. If Glenn and I had heard about a deal that someone said, you know, we're going to come and build a factory, there's going to be $1.7 billion that's going to employ 19,000 people, we'd fly around the world. I'd go to the legislature and say, look, I just need $70 or $80 million. Well, that's pretty well what I did with the medical. I just need about $70 or $80 million to build this new industry, because 19,000 Mississippians are going to be working at very good high-paying jobs, and the multiplier effect of that is people are going to be well. They're going to be healthier, so they're going to be able to show up from work. And they're going to be able to complete their jobs. So it is with great pride that we were able to do that. Medical City at Traditions. We went to then Lake Nona a couple of years ago. I don't know if any of you have been to Lake Nona in Florida now. When I flew into there, we had an opportunity to visit. Joe Canizero and I, we came back on fire. We said, we can do that. So Joe had a development in the middle of the Piney Woods in Harrison County, and I said, Joe, this doesn't need to be a mixed-use development. What we need to have here is a medical city. He didn't know he was going to have to donate land. But look what we have now. This is the new school here of nursing. We've got William Carey University serves as an anchor for the Tradition City. The new William Carey Osteopathic School of Medicine, which is in Hattiesburg and portion there of Tradition, Phase 1 of 50-acre campus. William Carey School of Pharmacy, now only the second school of pharmacy in the entire state of Mississippi. The other one is Oxford, Mississippi. So if you live in Biloxi and you want to be a pharmacist, where are you going? Louisiana, Alabama. Next thing you know, you're an LSU fan. We cannot let that happen. We've got to stop that. This is something, Mississippi Gulf Coast Community College. Mary, the president's here this morning. Nursing School and Simulation Center accommodates 800 to 1,000 nurses. Now, this is in the middle of a piney wood. I remember the first day we were out there breaking ground, everyone was just melting. It was about 112 degrees. And they had just knocked down the pine trees, and they left us a little piece of dirt we could all gather with our shovels. But now it's a beautiful, glistening center for that is just the marvel of the age there. Now the National Diabetes and Obesity Research Center Institute with Cleveland Clinic. We were having a Republican National Convention in Cleveland, and I had an opportunity to go by and visit the CEO of the Cleveland Clinic. Toby was such a remarkable man. I told him about it, and he said, I want to thank you for letting us come to Mississippi. You're going to hear from a physician a little later on from the Cleveland Clinic as well. And as we were having dinner last night, they said, you know, we're proud to be in Mississippi. Cleveland Clinic's proud to be here. Well, unfortunately, because our rate of obesity and diabetes is so vast, that they know the opportunity for great success is going to be so important here. Not only just for Mississippi, but the entire Gulf South and internationally. We've been around the world talking about opportunities. I was in Saudi Arabia not long ago. I think their diabetes population in Saudi Arabia is above 20%. Think about that. We're 15%. Theirs is above 20. So yeah, the kingdom needs our help, and for a slight investment, we're willing to help them with that. Children's Hospital at Blair E. Batson. Deborah and I love the Children's Hospital. We spend every Christmas Eve, we have for about the last 10 years at Blair E. Batson, giving out toys with a doctor dressed as Santa Claus and his family as the elves. And if you want to have a good Christmas, if you want to really know what it's about, you come go with us that Christmas Eve and see those children and their parents. This is the most remarkable health care center in the world as far as I'm concerned. And it's growing. As you see, there's going to be expansion. We broke ground December the 1st on 180 million, 7-story, 340,000 square foot pediatric tower. It's going up now. If you drive by there, you can see it. This is so important because as we see those small babies that are having issues with their hearts, they're in a hallway, and their mother is sitting in a chair next to them. And if we have to move them, we have to take them outside or across the corridor. And this is going to be a new great opportunity for the children of this state that probably would not have survived a decade ago. Now they will live healthy, prosperous lives because of this center and the people that have made that involved. William Carey University, Dr. King is here. I think he was, Dr. King, are you here? He will be. This is an amazing force of nature. He came into my office when I was lieutenant governor, and he said, Phil, we're going to build a medical school at William Carey in Hattiesburg, Mississippi. And I said, bless his heart. Bless his heart. You just can't build a medical school. I know that the red tape and all of the things that you have to go through to get a medical school would just be almost impossible. And he left there. He said, it's going to be osteopathic school of medicine, and we're going to get it done, and we're just going to have hundreds of new doctors across the state of Mississippi. Bless his heart. He did it. He absolutely did it. A wonderful college at William Carey there. If you look over 30 years, the number of osteopathic physicians practicing in the United States has quadrupled. He knew something we didn't know. 68% increase since 2007. 15% of the physicians in small towns and rural communities are DOs. 15%. That's where I need them. That's what we need desperately. So the accreditation is 34% osteopathic medical schools. And look at William Carey admitted the first class in August of 2009. So that was probably 2008 when I was first lieutenant governor, and I was worried about Dr. King's stability, and he opened the first class by 2009. What an amazing man he is. Guaranteed 450 positions. And so the enrollment is about 400 students now. As of 2017, there's over 609 DOs licensed to practice in the state of Mississippi. 609 new physicians. That's almost that new 1,000 I'm looking for, and we're going to get there a lot quicker than 2025. You see a pattern going here. You see what we've been able to do, and we're very fortunate to have William Mayo here, the DO, actually the president of the American Osteopathic Association. His dad was a member of the legislature. Am I right about that, Bill? Brad, that's right, Brad Mayo. Gosh, well, I had it backwards there. Brad, a great guy from Oxford, Mississippi. And so we honor the president here. We're certainly glad to have the president of the American Medical Association. But Dr. Mayo is one of our own, so I had to shamelessly put his photograph and information about him up there because this is what Mississippians can do when they set their mind to it. Telemedicine, you've heard it earlier. We're one of 7 states to receive an A rating by the United States Telemedicine Association. UMMC Telehealth, we've got over 500,000 patients helped since 2009. 500,000. Look at those help do telemedicine. 200 plus UMMC specialists, around 35 special services growing to 200 locations. We are exporting telehealth. So a Canton-based Tele1 Telehealth, this is a private telehealth company, began the process of connecting Mississippi healthcare through in Malaya, Africa, the mission hospital there in Africa. This is one of the opportunities for us to export telemedicine, both private and publicly, around the world. I was in Panama 2 weeks ago. The number one thing that the economic development officer at the embassy for the United States wanted to talk about, telemedicine. Panama is a very rural area. They need health care desperately throughout that nation. They have the funds to do so because they've got that big ditch called the canal down there, and it costs you an average of $1 million to move one ship through it, and their people are dying in the jungles. So we're going to get down there and see if we can help them, just like Telehealth One is helping in Africa. Mississippi Center for Medically Fragile Children. This is our latest mission. Some of the children in Blair E. Batson now becoming adults, and they've been in those hospital rooms for over a decade. Those of us that have been, I've spent one night in a hospital and I argued with the doctors about that. I didn't want to do it, I think they were right, but I couldn't wait to get out. Imagine if you lived every day in a hospital room. And that's what some of these children have been doing for over a decade. Now they're becoming adults. Probably not long ago they never would have survived. I think they're going to be with us a long time. So they need some extended care. But also this facility, Deborah gave me notes this morning. She said medically fragile children, transitional care facility. So it is a transitional care facility. So I can appreciate that you come out of the hospital, you're young, you're medically fragile. Your parents are trying to adjust to that. They're trying to get their home adjusted to the care that they were going to and hope will provide you. And this is what this center will do. Now, again, it's going to be a little challenge for us. It's about a $12.2 million center. We've raised about $2 million, about $3 million, I stand corrected. And so if any of you want to help, naming opportunities are available. But we're going to do this because I can tell you I'll never have a moment's peace until this gets built. It will never end because we've been married 44 years. I'm going to build this thing if I have to get out there and start laying bricks next summer. But it's so critically important, and it gives us another opportunity to tell people what can happen. UMMC, I tell you, the medical center just keeps leading the way. Every time I look up, they're doing something great. Again, Center for Emergency Services there. We broke ground on August 10th. It is obviously for those emergency responders. The center will provide enhanced coordinated among emergency response agencies, allowing faster deployment of medical care in those situations that develop into an emergency. So critically important. Healthcare is certainly complex, but it's also an economic developer. So as you heard earlier, we developed now about a dozen healthcare zones. We are laying the opportunity zones that the federal government through the U.S. Department of Treasury now offer. So we're overlaying those opportunity zones on top of those healthcare zones. So we're actually building workforce housing in many of them. So I got an extra credit from the federal government if we build workforce housing. As I tell people, the lady that's changing the sheets on your bed in the hospital room deserves a decent place to live. So we've been going all over building houses. We've been through tax incentives, incentivizing companies that are out there starting new medical zones, starting new medical facilities. We're encouraging now medical manufacturing. We have a beautiful medical manufacturer over in Flowood, Mississippi that makes a lot of the artificial joints that someday I'll probably need. And they're being manufactured right here in Mississippi because of the tax credits that help them through the medical zone. If you see the FedEx chain, the medical device division, 450 jobs, $12.6 million. Hattiesburg Clinic, I heard Clay talk about this morning. Hattiesburg Clinic, a phenomenal location. There's so much I couldn't include in the slides. I'd be up here all day. North Mississippi Medical Center, and I know I'll get stopped. I'll get down and somebody will come up and say, you forgot to mention what we're doing. Absolutely I will, because there's so much going on. But this is really the key numbers, $26.3 million investment. Vicksburg River region, $15.9 million. It is an opportunity for us, as we said, to treat health care as an economic driver, to treat it just like, if not better than, some of the other industries that occur around the state of Mississippi. The acute care hospitals, I said it earlier, the Hospital Association is doing a remarkable job working with the legislature, working with us, working with caregivers, working with Medicaid to make sure that we keep a vibrant hospital system throughout it. 60,000 employees, $14 billion economic impact to the state of Mississippi. Also 21 federally qualified health centers. FQHCs are critically important, particularly for the underserved areas throughout the state of Mississippi. I wish I had 14 more. These are really unknown systems quite often that do such a remarkable job, and we're very proud of what they do. And so welcome to the Governor's Healthcare Economic Development Summit. I hope you have a wonderful day, and thank you for giving me the opportunity to speak to you.